Hey everyone, and a massive welcome back to MediByte. I am so glad you're here. As a healthcare professional with the MediByte team, my absolute favorite thing to do is take the complex science of our bodies and break it down into something that's not just easy to grasp, but honestly, pretty fascinating. Today, we've got a highly requested explainer lined up for you. We're totally pulling back the curtain to demystify premenstrual syndrome, what we all know as PMS, and its much more severe counterpart, PMDD. We're going to dive straight into the biology, the actual lived experience, and the hard, actionable science behind the whole shebang. So, let's get into it. Now, you might be wondering, is it really just a bad mood, or is it biology? For decades, the very real physical symptoms of PMS were just brushed off as stress or someone simply being grumpy. But today, we are thoroughly validating those experiences. Why? Because they are rooted in some seriously complex internal biology. If you've ever felt, completely unlike yourself in the days leading up to your period, I want you to know right now, it is a tangible biological process. And to understand exactly how it works, we have to start by looking at the brain's control center. Okay, let's dive into this. It's basically an incredibly intricate chain reaction that runs the entire menstrual cycle, and it all kicks off in your brain. Specifically, a tiny region called the hypothalamus, which kind of acts like the grand conductor of an orchestra. It releases pulses of a hormone called GnRH. This sends a signal straight to the pituitary gland, also in your brain, telling it to release luteinizing hormone and follicle-stimulating hormone. Think of these as little messengers that travel all the way down to stimulate your ovaries. Finally, the ovaries get the memo and start pumping out the heavy hitters, estrogen and progesterone. This whole elegant but super sensitive hormonal cascade is what ultimately controls menstruation. Now, when that hormonal cascade causes physical and psychological disruption, that's when we get premenstrual syndrome. But let's define PMS with a bit of scientific precision here. PMS isn't just some vague general feeling. It's actually a specific cluster of symptoms on a very strict timeline. They start several days before a period kicks in, and here's the absolute defining hallmark of PMS. Those symptoms almost always vanish completely within just a few hours after the first day of the period. That highly specific timing is exactly how clinicians distinguish PMS from other, more continuous medical conditions. If you have ever felt totally isolated by these symptoms, I promise you're not alone. Just look at the numbers. Among reproductive age women in the US, roughly 13 to 18%, let's average that out to about 15.5%, experience clinical PMS. And another 2 to 6% face the much more severe form, PMDD. To put that into perspective, we are literally talking about millions upon millions of women worldwide managing these exact same biological hurdles month after month. It's incredibly common, and honestly, it's completely normal to seek help for it.
All right, moving into part 1, the root causes of PMS.
The truth is, there's no single magical PMS gene or one isolated cause. It's much more like a giant, multifaceted puzzle. The primary driver, for sure, is that intense fluctuation of estrogen and progesterone we just talked about, but it goes way deeper than that. Those shifting hormones can actually disrupt serotonin levels in your brain, which directly impacts your mood. We also know there's a genetic predisposition, meaning, it can run in families. And get this, recent research even points to shifts in the gut microbiome during your cycle, alongside simple deficiencies in key minerals like magnesium or calcium. So it really is a complex whole-body event. And this brilliantly illustrates how those hormonal shifts impact completely different bodily systems. Take, for example, a hormone called aldosterone. Aldosterone's main gig is to regulate your salt and water balance. But when estrogen and progesterone fluctuate, they can totally throw aldosterone off balance. When things get out of whack, you end up with excess aldosterone. This basically screams at your body to hold onto salt and water, which is directly responsible for that super uncomfortable fluid retention and bloating so many women get right before their period. Next up, part 2. Recognizing the symptoms.
As you probably know, PMS casts a very wide net. On the physical side of things, you've got the bloating we just mentioned, profound fatigue, breast fullness and pain, and sometimes really severe headaches or even joint pain. Then, on the psychological side, women often report intense irritability, anxiety, sudden crying spells, depression, and even insomnia. And the crazy thing is, the type and intensity of these symptoms can vary wildly from woman to woman, and even from cycle to cycle. It's a heavy, dual-sided burden to carry.
But we absolutely have to differentiate between standard PMS and premenstrual dysphoric disorder, or PMDD. While standard PMS is definitely disruptive, PMDD is just on an entirely different level. With PMDD, those premenstrual symptoms become so overwhelming that they actively interfere with a woman's ability to work, socialize, or just maintain normal relationships. Everyday activities literally lose all their appeal. And tragically, women dealing with PMDD might even experience suicidal thoughts. It is a severe, life-altering condition, and it absolutely requires serious medical attention.
Which brings us to part 3, the diagnostic journey.
First off, as your healthcare guide today, I really want to equip you with the right vocabulary. Doctors use very specific medical terms, and knowing them empowers you to advocate for yourself. For instance, if you have extremely painful periods or cramps, the medical term is dysmenorrhea. If your periods have stopped entirely, that's called amenorrhea. Then, as we know, PMS refers to those pre-period symptoms, and PMDD is the severe, debilitating version. Using these precise terms in the doctor's office helps our physician immediately narrow down exactly what you're experiencing. Now, what's really interesting about this slide is that the most powerful diagnostic tool here isn't some fancy blood test or an expensive MRI. It's actually just a simple daily symptom record. To officially diagnose PMS, and especially PMDD, clinicians need you to track your physical and emotional symptoms every single day for at least 2 full menstrual cycles. You might wonder, why? Well, because the diagnosis completely hinges on the timing. They need to see that undeniable, repeating pattern of symptoms, showing up before the period and resolving shortly after it begins.
All right, let's look at part 4, actionable treatments and lifestyle changes.
We always like to start with the foundation, right? Lifestyle adjustments. And the science here is actually highly effective. Getting at least 7 hours of sleep and doing some regular, mindful exercise like yoga or Tai Chi can drastically dial down irritability and insomnia. Diet is massive too. Remember aldosterone from earlier? By just eating less salt, you directly reduce that annoying fluid retention and bloating. And, I know it's tough, but cutting back on sugar and caffeine, yes, unfortunately even chocolate, while upping your protein and complex carbs, can really help stabilize your energy and your mood all day long. Beyond everyday diet, certain supplements have actually shown some real promise in easing these symptoms. Believe it or not, calcium supplements can improve mood and even lessen physical pain. Chasteberry extract, vitamin E, and vitamin B6 are also frequently used. But, and I'm saying this firmly as a healthcare professional, it is absolutely essential that you chat with your clinician before you start taking them. Supplements are powerful, and they definitely aren't without their risks. So the crucial point is, while vitamin B6 can be super helpful, self-medicating with high doses is incredibly dangerous. Actually, taking as little as 100 milligrams of vitamin B6 a day can literally cause nerve damage? No way, right? This is exactly why we constantly emphasize working directly with your doctor rather than just pulling random bottles off the pharmacy shelf. When it comes to supplements, more isn't always better. Precision is what really matters. Now, when lifestyle tweaks and supplements just aren't cutting it, we can turn to pharmaceutical interventions. For physical pain, things like cramps and headaches, starting an over-the-counter NSA a few days before your period can work absolute wonders. But if severe psychological symptoms or PMDD are the main issue, antidepressants, specifically SSRIs, are actually the first-line choice for relief. We also frequently use hormone therapy, like daily birth control pills, to try and just level out those wild estrogen and progesterone fluctuations. And hey, if you're battling severe bloating, a prescription diuretic called spirolactone can help your kidneys flush out all that excess salt and water. When we're dealing with really stubborn, treatment-resistant PMD, there's a specific, escalating path of care we follow. We'll typically start with those SSRIs and hormonal therapies. If the symptoms are still persisting and making life miserable, doctors might step up to GnRH agonist injections. These basically hit the pause button on the ovaries, stopping them from producing those fluctuating hormones. And then, as an absolute last resort, when literally nothing else works and PMD is destroying a patient's quality of life, surgical removal of the ovaries becomes an option. It instantly cures PMD by ending the menstrual cycle entirely, but it does force the body into early menopause, which is why it's strictly reserved for only the most extreme cases. Wow, okay, we have covered the brain chemistry, the daily realities, the diagnostic journey, and the whole spectrum of treatments. So I want to leave you with this final provocative thought. Are you ready to take control of your reproductive health? You now have the right vocabulary, a solid biological understanding, and you know exactly what treatments are out there. Don't ever let anyone brush you off by saying it's just a bad mood. Your experience is real, the biology is crystal clear, and relief is absolutely possible. Track your symptoms, speak to a professional, and please advocate for the care you deserve.
Thank you so much for joining me today for this deep dive into PMS and PMDD. If you found this explainer helpful, and I really hope you did, please do me a huge favor. Like this explainer, share it with anyone in your life who might benefit from understanding their body a little bit better, and hit that subscribe button. Here at MediByte, we are totally dedicated to bringing you clear, accurate, and super engaging medical explainers every single week. Stay curious, stay healthy, and I will catch you in the next one.